Hi, this is Dr. Bruno. We're coming to you live from our office in West Hollywood. This is a first of our Facebook Live series, so please bear with us. But we've come up with some questions over the last couple of weeks from current patients and potential patients about general questions about plastic surgery that I thought that I would take this opportunity to answer. Should you have any questions, please feel free to comment below. But I'm going to get started and just go over a couple of these. I'm sure some of these may relate to some concerns that you may have out there. But here we go. This first question is from Andrea in West Hollywood. She says she's been researching getting a Brazilian buttock lift and came across buttock implants. Which do you think is better and why? Well, most patients prefer a more natural look, more natural feel to the buttock, which generally is achieved with Brazilian buttock lift, which is a fat transfer to the buttock, which is performed by doing liposuction on a number of areas, harvesting the fat, processing the fat, and then re-injecting this into the buttock and the gluteal area. Most of the fat survives after a couple of months. About 60% of the fat survives and it's permanent. Comparing that to silicone implants, which is a hard silicone structure that's inserted under the muscle or under the fascia of the gluteal area, tends not to look as natural, tends not to feel as natural, and most would say it has a higher complication rate. So generally speaking, if you're thinking of buttock augmentation, provided you have enough fat, most plastic surgeons, and myself included, would recommend Brazilian buttock lift. Hope that answers your question. Another question coming in from Beverly in West Hollywood, saying there's a lot of information online about choosing a board-certified plastic surgeon. Do I need to choose a board-certified surgeon? Well, I think generally speaking, regardless of what procedure you're thinking about, whether it's plastic surgery, internal medicine, gynecology, what have you, I think it's a good idea to go to a board-certified doctor who's been trained in the procedure that you're interested in and has the credentialing such that you can have a safe outcome. I think as it pertains to plastic surgery, there's some confusion out there as to should you go to a cosmetic surgeon, plastic surgeon, what's the importance of board certification? It's just another level of credentialing. I mean, as a plastic surgeon, I would, I wouldn't go to a gynecologist for a tummy tuck, although there are some gynecologists out there doing that procedure. They may not be trained to do it, but they're doing it. Same way I wouldn't deliver a baby. I'm a plastic surgeon. That's outside of my specialty, even though I'm a doctor. But yeah, it's important to do your homework, and you can look on American Society of Plastic Surgery website, American Board of Plastic Surgery websites to see if your surgeon is in fact board certified. Cosmetic surgeons oftentimes are a non-plastic surgeon, for example, a gynecologist or even an internal medicine doctor or radiologist who may have taken a course and is in the position to call themselves a cosmetic surgeon, but they don't have the degree of training and a degree of credentialing. But that's just the basic overview of board certification. I do think it's important. I do think when you're choosing a plastic surgeon, that's one of the criteria you should look at. Another question from Donna in Beverly Hills, asking about, I've seen a lot online about breast augmentations being extremely painful. Is this true? Breast augmentation, typically when the implants are placed under the muscle, I do think for the first couple of days, there's a lot of tightness and pressure. But after about 3 days, most patients are off pain medicine. They can drive, they can go back to office work. It does take about 4 to 6 weeks before you can resume exercise with your upper body. But with muscle relaxants and with narcotics, most patients are actually fairly comfortable after the first 3 days. Next question here is from Lisa in Burbank. How often do you see capsular contracture and how can it be prevented? Well, I guess I would start out by sort of defining capsular contracture, which is basically a term for hard scar tissue that forms around the implants after breast implants after surgery. The process typically happens because bacteria in the breast tissue can become attached to the implant upon insertion, and this can trigger a slow, gradual hardening of the implants. The best way to prevent this is really choosing the right incision, The incision that has the lowest incidence of capsular contracture is an incision that's placed in the crease of the breast, trying to avoid the areola, as there's a lot of bacterial contamination there, and that's one of the higher incidences of capsular contracture. A lot of things regarding the technique: using the Keller funnel, which is a special device used to insert the implant, changing gloves, using special triple antibiotic solution prior to insertion. So there are things you can do to minimize it. You can keep the chances of capsular contracture pretty low, probably less than 10%, maybe even as low as 3, 4, 5%. But yes, there are ways to prevent it. Another question here from Heather, Redondo Beach. Is there any way to limit the scar from a tummy tuck? Well, you can limit the scar from a tummy tuck. I can't say you can erase the scar from a tummy tuck, but some of the best ways to reduce it are using silicone products after the surgery, whether that is a silicone tape such as Embrace, which is a commercially available tape. You can purchase that online, which is very effective at decreasing the width and the thickness of the scar. And it's usually applied about the second week after surgery and used for 8 weeks. You can also use silicone gel, which is also effective. And also just the closure, at the time of closure, not closing the incision with too much tension. This is more, issue for your surgeon, not so much for you, the patient. But if the incision isn't closed under too much tension, and the patient's not standing up too straight right after surgery, generally takes about a week before you're fully upright. This can also help minimize the scar and help prevent having a thick or wide scar. Hope that answers the question there. Here's from another patient, Rena, Beverly Hills. I recently got a Brazilian buttock lift, but I'm scared the results won't last. Is there anything I can do to prolong my Brazilian buttock lift results? Well, generally speaking, when you're doing a fat transfer to the buttock or anywhere else, a certain percentage of those fat cells are going to survive, and a certain percent are going to atrophy or shrink. About 60% of the fat cells will survive, and it takes a couple of months for you to determine that. What can you do to help prevent that? One of the most important things is avoid direct sitting on the buttock. If you're sitting or applying too much pressure on the buttocks, such as sleeping on your back, sitting for prolonged periods of time in the first couple of weeks, that's going to put undue pressure on the fat cells, and it'll cause a lot more than 40% of the fat cells to shrink and atrophy. So we generally recommend a minimum of 2 weeks, closer to about 4 weeks. If you can make it 4 weeks without sitting after a fat transfer to the buttock or Brazilian buttock lift procedure, then you'll really optimize your results, and the lowest amount of fat cells will end up atrophying or shrinking. So there are a lot of ways to do that. There's some special pillows that are out there. There's a BBL pillow, which is available online, which you can purchase after surgery to use if you have to be back in a work setting or in an office setting. I think using pillows or modifying your sitting is very important for the first 4 weeks. Hope that answers that question. Another local question, Alexandra, Beverly Hills. I've heard Kybella can remove her double chin permanently. Is that true? Well, yes, it is true. Kybella basically is a really minimally invasive. It's an injectable product. It's injected into the chin area. It's FDA approved. It's been around for several years. And basically, it's a chemical that will permanently destroy the fat cells in the chin. It's a procedure that's done in the office. Takes about 20 minutes or so to do. The injections are done under some local anesthesia, really just topical ice. After the injections, the area does swell up. It does burn a little bit at first. Then 6 weeks later, typically there's a second session, and sometimes even a third session, depending on the thickness of the neck. But it permanently destroys the fat cells. The fat cells will not come back. If you gain weight, fat cells in the area can increase in size, but the fat cells that were treated with the Kybella do not return. So if you have pretty good skin and a mild to moderate amount of fat, Kybella is a great non-surgical option that is available. Here's a question from a patient, live question. Can you do a tummy tuck with a BBL? Well, the answer is yes. If you're in good health, you can combine a tummy tuck with a fat transfer to the buttock. That combination of the procedure takes about 4.5 to 5 hours. So it's important to be in good health, be close to your ideal weight, ideally in a non-smoker to help minimize complications. And the tricky part of that recovery when you combine tummy tuck and Brazilian buttock lift is the positioning. You can't lie on your stomach because you've had a tummy tuck. You can't lie on your back because you've had fat transfer to the buttock. So generally speaking, you're going to want to be on your side for those first 2-3 weeks. And I find some patients find that to be challenging. However, the positive side of that is you'll have one surgery, one anesthesia, and you're getting everything over with at once. Some patients who don't think they're going to be able to tolerate that position, or maybe they don't have the best health condition, it may be wisest to separate those out into 2 separate procedures. And that's something we could always discuss during a consultation, or any questions that you could submit to me online. But that's a good question. I've done that combination many times, tummy tuck with Brazilian buttock lift, and some patients are glad that they got it over with. Some patients said they probably wouldn't do it that way again, and they would probably separate into two separate operations, which, by the way, I would separate out by about 6 months if you were to separate them. Let's see. Another question here. This is from Leanne in Hollywood. Let's see. I've been waiting a while to get a tummy tuck. Now it's bikini season right around the corner. How soon will I see the results if I get a tummy tuck? Well, I would give yourself at least 2 or 3 months to allow for swelling to reside, allow for the healing. Even though the scar may still be somewhat dark or red at that time, I would certainly not do a tummy tuck if you're planning to go on a vacation like a month or 2 later. I'd say 2 to 3 months would be a little bit more comfortable in terms of healing. Most of the bruising's gone in about 2 weeks, but as far as your mobility, activity, you can't do really any heavy lifting or anything strenuous for about 6 weeks. So keep that in mind. As far as being in the sun, you can be in the sun, but the scars in the first year, they're sort of vulnerable to the ultraviolet rays. So it's important to use sunscreen or really protect the scars, minimize the direct sunlight exposure. If you are planning to have surgery this time of year now, it's the middle of March, if you're going to have that area of your body exposed, let's say in the summer, in June or beyond. Let's see. Well, those are most of the questions that we had here. If anyone has any other questions, we're happy to field those questions. But I think for now, we're going to sort of wrap this up here, unless I see any other questions come in. Well, one other one here. Actually, can I exercise after a Brazilian buttock lift? The answer is yes, you can exercise after surgery. However, for the first 6 to 8 weeks, while the fat cells are reestablishing their blood supply, it's important not to exercise too much. If you're exerting yourself too much and you're burning too much fat, then you're going to sort of defeat the purpose and you're going to injure those fat cells. They're not going to get enough nutrition, and you may experience more than 40% shrinkage of the fat cells. So it's very important. Other than walking, basically the first 6 to 8 weeks, you're going to maintain your body weight, maintain a normal amount of calories, and try not to exert yourself. When you do resume exercise, I recommend doing things that are building up the lower body: squats, lunges, strength training instead of extensive cardio activity, which is going to burn fat. We don't want to burn the fat, certainly in the gluteal region, as that's going to compromise your results. But I think that's it for today. If anyone has any other questions about really anything related to plastic surgery, not just the questions that we covered here, feel free you can reach us online. Actually, you can email us directly at wb@williambrunomd.com. But that's our website, williambrunomd.com. And you can reach us at by phone at 310-461-3855. And you can reach us here through Facebook if you need to. But anyway, appreciate your time. Again, this is our first time doing it. If you have any feedback, any ways that we could improve this, any other topics that you would recommend that we cover, just give us a call or reach out to us via social media, Facebook, Instagram, Twitter, whatever your choice is. But anyway, thanks again, and everyone have a good weekend, and we're signing off now. Take care.